I, Dr. Nasreen Laiq, President Pakistan Society of Anesthesiologists, Pakistan, welcome you all on this very special day. I would like to thanks to all the participants of this event, and I am especially thankful to Dr. Junaid Sarfaraz Saab, who is Dean of MDI LRH, Dr. Ebrar Saab, who is HD of Lady Reading Hospital, and Dr. Tariq Barki Saab, who is HD of MDI LRH. For their participation on this very special occasion. It's a pleasure to have you all amongst us here this afternoon, and certainly an even greater pleasure to stand here meeting you all. Let me tell you something about the Lady Reading Hospital. It's one of the biggest or largest public tertiary care teaching hospital in Pakistan. It is conveniently located at the center of the city as an eminent landmark in Peshawar. It has 1800 plus bedded capacity, 1350 doctors, 4500 staff serving the community for more than 100 years in all medical disciplines. The hospital catchment population includes patients from all over the province, henceforth fulfilling the health needs of the whole of the KPK province, and also providing services for many patients from Afghanistan as well. A 24/7 emergency and accident department, according to one estimate, its outpatient clinic sees above 5500 patients per day, and emergency department sees about 2500 to 300 cases per day or patients per day. Number of OTs are 85 in number, out of which 36 ORs are running 24/7 round the clock for each and every nature of emergency services. 50 to 60 ORs are running for elective surgeries, and round about 250 to 300 minor to major surgeries are being performed in 12 scattered OTs. All kinds and sorts of surgeries like general surgery, orthopedic, neurosurgery, plastic surgery, maxillofacial, ENT, eye, urology, gynae, peds, vascular, and cardiac surgeries including open and closed heart surgeries are being performed here. Department of Anesthesia also provides services on sedation and anesthesia outside operation theatre, like in radiological procedures, in CT, MRI, interventional radiology, endoscopies, in psychiatry, and also in cath lab. We have 6 ICUs, that is surgical ICU, medical ICU, neurosurgical ICU, peds cardiac and adult cardiac ICU, and thoracic ICU, providing critical care to patients on 45 to 50 beds. I would like to briefly discuss the history of anesthesia. I think it's very important, and I'm sure it will be interesting to know that how there has been a revolution in the world after the discovery of anesthesia. So general anesthesia was absent till the mid 1800s, and ether, as Sophia has discussed, was first time publicized as anesthetic agent in 1846 by a dentist known as William Morton. Dr. William Morton is also known as father of anesthesia. Ether is no longer used as anesthetic agent in the modern practice. However, it is considered to be the anesthetic agent of choice in the past. This is the ether bottle. You can see it in the slide. And here is the mask through which ether is being delivered on the left side. Can anybody guess who is she? This lady? Lady. What's the name name of the queen? She's Queen Victoria. Yes, she's Queen Victoria. Ether was for the first time tried to relieve the pain of labor to Queen Victoria during her childbirth. Chloroform was used as anesthetic agent in 1853 by John Snow, but the drug was rejected because of its very much side effects. In this slide, you can see the Ether monument. It's on the right side. It's located in the state of Boston in the United States of America. And in the other slide, you can see the special kind of apparatus through which ether has been delivered in the past. In the past, escape from pain in surgical operation was a dream. Knife and pain in surgery were words which were always inseparable in the minds of patients. A very similar frightening situation here in this picture as well. Of course, there was always the ever popular 10 people hold the screaming man while the surgeon slices him open. It seems ridiculous now, but once upon a time, the options for pain relief included to strangulate the patient till loss of consciousness, or the patients were used to be beaten on heads with a club till they lose consciousness. And sometimes they used alcohol overdose them till they get really drunken, and only then surgery were used to be performed. Sheshruta, the father of surgery, practiced in Banaras in 1600 BC, and the Morton, who is known as father of anesthesia, was a New Englander in the 18th century. Think about it. It took 2400 years for these star-crossed fields to meet, and the humanity suffered 2400 years of pain, tears, and screams of agony. There were plenty of failed attempts as the 18th century arrived. Finally, on 16th of October 1846, the dentist Dr. William Morton stepped in front of live audience of physicians and surgeons at Bullfinch Amphitheatre in Massachusetts General Hospital. Another picture of the same theatre. First surgery was performed in the presence of live audience. Since then, 16 October is celebrated as World Anesthesia Day. The World Federation of Anesthesiologists celebrates World Anesthesia Day annually with over 134 societies representing anesthesiologists from over 150 countries. Now you can imagine and compare this kind of OT with the one in the past. All that have been made possible because of the inventions of sophisticated and reliable machines and drugs and gadgets, which had bring a revolution in the life of humanity. It is now over 150 years since that day when world changed for medical care. Anesthesia has evolved, and so too have the anesthesiologist. The once impossible general anesthesia is now exquisite precision, attaining not just loss of consciousness but also muscle relaxation, making surgeons happy, pain relief, making patients happy, and of course stable cardiac vitals, making the anesthesiologist happy. The magic does not end there. Today, anesthesiologist roles extend far beyond to include being part of the pre-hospital emergency response team, plays a pivotal role in the management of acute and chronic pain, running the intensive care unit, handling everything from snake bite victims to comatose patients, The true value of anesthetist is known to every surgeon who works inside an operation theatre when things gets rough during a surgery. With severe blood loss or sometimes a drop in vitals, and when surgeons look at the blood-soaked swabs and container full of blood, it's really terrible for a surgeon to think about it. It is the anesthesiologist who is looked upon to take over and stabilize and resuscitate the patient. I still remember the golden words of my departmental head when I was resident once, that the surgeon is the head of a sailing ship, but the anesthesiologist is the head of a sinking ship. Anesthesiologist tries his level best to bring out the patient from crisis during difficult surgeries. 16 October is World Anesthesia Day. My question is here, have you thanked your anesthesiologist yet? I would like to salute and appreciate the anesthesia department, including consultants, medical officers, trainees, anesthesia technicians, paramedics, and all the auxiliary and supporting staff for their untiring efforts, hard work, and dedication in the management of surgical patients and critical patients in ICUs, which would be impossible without the involvement of all these heroes. In the end, I am also thankful to pharmaceutical companies who have supported us in the arrangement of this special event. Thank you very much.